This is a CT scan of abdomen and pelvis of a 37 years old male patient. He is a known case of lymphoma. I just want to show you few findings regarding kidneys. Now there is scarring at the upper pole of right kidney. Please first observe right kidney. There is no renal sinus fat. Low down there is again cortical scarring. There is a small tiny calculus here. Now we move on to the left kidney. Now this is left kidney. Again you do not find the renal sinus fat which normally is present and extends along the major calyces. Renal sinus fat is present at the level of the renal pelvis. This is renal pelvis, it is dilated. There are two tiny calculi at the lower pole of left kidney. This one here. And second one is, this one is the second calculus here. Now I will show you the contrast NAN CT scan. First let me show you the extent of the lymph nodes. Now these are the lymph nodes. This group of lymph nodes lies in left anterior cardiophrenic angle, and these are the lymph nodes along right heart border. Inside abdomen, these are the enlarged lymph nodes in gastrohepatic ligament. These are making conglomerate masses. Lymph nodes along the celiac trunk, along right hepatic artery, along splenic artery. Now these lymphoid masses, these lie posterior to the head, body and tail of pancreas. Their interfaces with the pancreas are indistinct, and there is likelihood that there is infiltration of the adjacent pancreas. Now this is the superior mesenteric artery, enlarged lymph nodes along the superior mesenteric artery. Similarly, enlarged lymph nodes in para-aortic region, in inter-aortocaval region, retrocaval region, and in mesentery. These extend downwards and along both the common iliac vessels. There is no extension of lymph nodes along the external iliac vessels. Now I go back again. As I mentioned it previously, there is infiltration of fat in the region of renal sinus and along the major calyces. Please observe these soft tissue density shadows here. I will show you these further in the delayed scan as well as on left side here. The lymphoid masses have surrounded renal arteries and renal veins. Now this is the delayed scan. Patient is a known case of lymphoma. Now please observe calyceal clubbings, distortions. Normally the fat should have been here, but there is soft tissue density shadows which are extending along the major calyces, and there is thickening of wall of the renal pelvis. Now please observe how squeezed renal pelvis is because of this lymphomatous infiltration in the region of the renal hilum, sinus fat, and along the major calyces. There is clubbing of the calyces. Proximal part of right ureter slightly prominent. It is involved by the lymphoid masses here, pericable. Its lumen is narrowed up to this level. Now I will demonstrate the findings on left side. There is mild hydronephrosis on left side. Similar soft tissue density shadows extending along the major calyces, but renal pelvis is partly spared. Please observe this fat here, but its posterior wall is thickened, renal pelvis is dilated, proximal ureter is dilated. Patient has got bilateral simple renal cyst. Now again at the same level as of right ureter, left ureter is involved by the para-aortic lymphoid masses. Its lumen is narrowed. This has resulted in mild hydroureteronephrosis on left side. Low down in pelvis, lumens of both the ureters are almost of normal caliber. Now I will show you further delayed scan. Again, clubbing on right side. Mild signs of obstruction, but on left side, mild hydroureteronephrosis is present because of the involvement of left ureter by the para-aortic lymphoid masses. So this is a case of lymphoma. Spleen is also enlarged, but as such there are no lesions in spleen, and infiltrative masses are present in both renal pelvises, which are extending upwards and downwards along the major calyces, obliterating the fat planes. These must be looked carefully while doing ultrasound because the fat echoes are deficient in such cases. These are replaced by the soft tissue attenuation areas which are squeezing the collecting system.